Our goal as a radiology residency program is to train residents to be as good as they can possibly be in diagnosing diseases, in treating patients, and ultimately in communicating with referring physicians in a way that shows the excellence of this program.
Diagnostic radiology, I think, to me, has become kind of the center of all clinical medicine. No patient goes through their entire hospital stay now without having at least one imaging study, whether it be cross-sectional or just something as simple as a chest x-ray.
So when I was an applicant looking at interventional radiology and diagnostic radiology programs, I was trying to find a place that would have great training in both. There's a lot of places out there with great training in either, but IU for me was the perfect combination of both.
Building those programs together, strategically, intentionally incorporating them from the very beginning for both the diagnostic radiology residents and the interventional radiology residents in a balanced strategic approach is by far the most important part of our overall mission.
When looking at IU, it was quite clear that IU was a powerhouse with regard to diagnostic radiology and interventional radiology. Because we service such a large community with so many hospitals, I knew that the educational value would be endless here.
The proximity of 4 very large hospitals in central Indiana provides a tremendous experience for our residents. They rotate through Eskenazi, our county hospital, Riley Children's Hospital, University Hospital, a large academic center, and Methodist Hospital, the largest tertiary care referral center in the state of Indiana.
Additionally, the interventional radiology program, we get to intervene on those trauma patients, those pediatric cases, those things that you really don't see if you were at a major academic center, say in a big metropolitan area where you have 4 or 5 institutions within a 1 or 2 mile radius.
We do a great job in our program of giving residents graduated autonomy, sitting next to and working directly with a staff member at the beginning of your residency, and then as you progress and learn skills and become more independent, you are more on your own, always with excellent supervision.
One of the strengths of our program is that because we have such a large residency program, because we have so many resources to pull from, that it allows you to do whatever you want. Sky's the limit with respect to what you can achieve here.
Every single year since I was a first-year radiology resident, I've had the chance to go to different radiology conferences across the country. I've been to Miami, Hawaii, Chicago, and Philadelphia, and gotten to share my research that I've worked on with different attendings as well as other trainees.
There's no shortage of research experiences here at Indiana University. Anything from AI research to research in resident education.
Whether it's academic radiology publications or scholarly articles in The Atlantic, our residents pursue their passions and take whatever they're interested in to a new level.
Being able to live comfortably downtown and also be able to go to work 5-10 minutes away without having to worry about very big significant traffic or burdens. I think all those things kind of play into the fact that living in Indianapolis is awesome.
We have an amazing park system. If you've ever watched Parks and Rec, they're not lying. We have some amazing parks to visit in this city. Great people, wonderful kind of hospitable culture as an Indiana resident, and then amazing restaurants and kind of nightlife and culture too.
I do have a family, and so being in a family-oriented area, somewhere where I could raise my family, where I think they could thrive, was very important to me.
Such a privilege to be involved in the training of residents as they go through this process, coming in as first-year residents, knowing very little about radiology, to the point where as fourth-year residents, they are incredible experts in the field. Watching that process is an incredibly rewarding experience, and it's a privilege for me to be able to be a part of that.
The attendings are all so supportive and so friendly, and that's one huge reason why I came to IU, is just how friendly everybody was. It's a family atmosphere.
There's a ton of camaraderie here. I feel so close to all the residents that I work with.
People are willing to accept and understand that you might want to pursue a path less traveled or something that might be far-fetched to others, but here people are going to support you in whatever endeavor you decide to pursue.